It's a real pleasure to be here with you today. My name is Dr. Lloyd McCann. I'm the CEO of Mercy Radiology and Clinics and Head of Digital Health for Healthcare Holdings Limited. We're here today to talk about the year that has been 2020 and this little thing called Covid-19 and how that has become a catalyst for innovation for us here in New Zealand and within our context at Healthcare Holdings Limited. We're actually going to be examining the opportunities Covid-19 has brought and how we've harnessed those opportunities to drive better patient care along with our technology partners. We're also going to be talking about something that's changed for us this year, a virtual go-live of one of our core systems, our EMR, and how our partner InterSystems enabled us to make sure that went really well. Going to be exploring some uses of healthy data and how that has enabled MercyAscot and Healthcare Holdings Limited to become a data-driven organisation. In terms of our local context, so Healthcare Holdings Limited, we've already been on a journey of digital transformation. We see digital health as a critical enabler for value-based healthcare. Foundational to all of this then is our patient administration system and our electronic medical record. So in terms of the MercyAscot context, we are definitely behind where we want to be in terms of PAS and EMR until we began our engagement with our excellent partner InterSystems. We've not been able to truly deliver on these digital health approaches without having a modern and consumer-centered as well as clinician-friendly PAS EMR in play. So we knew we needed to address this and went through a process to identify InterSystems and the TrackCare product as the PAS EMR that would enable our systems moving forward. A few firsts have occurred obviously within this space for us as well. So within the New Zealand digital health landscape, we generally have always gone for a best of breed approach to delivering virtual health or digital health. Within the MercyAscot context, however, we are the first integrated PAS EMR solution in the country that is actually being deployed in the cloud. So a few challenges obviously needed to be worked through in terms of getting to where we've got to around our PAS EMR. What Covid-19 did was create a crucible environment for us. We had been working with our partner InterSystems and other partners in terms of our PAS EMR for a number of months. And of course, right at the time we were gearing up to go live, Covid-19 changed a number of things for the organisation, which forced us to look at a virtual go live. So when I say virtual, I'm talking about a remotely supported go live of a significant application for the organisation. One of the key tenets of any deployment, as many of you will know, is that you need the support of your vendor partner on the ground to provide that at-the-elbow support for your clinicians and for your clinical teams to ensure that that go live runs smoothly. Given the restrictions around travel for managing Covid-19, we did not have what I've now come to learn is actually the luxury of having our vendor partner on the ground to support our go live. So we had a choice to make. We either wait, we ride it out, wait for Covid-19 to disappear, or find a different way to go live. And after some careful consideration, we decided that the latter option was something we needed to aggressively explore and implement. What this meant was reliance on technology. So we utilized tools like Microsoft Teams, we utilized tools like ticket trackers, we utilized tools like Trust to enable this virtual go live. In essence, we needed to take a leap of faith to enable this virtual go live. And we relied heavily on the remote support of our partner InterSystems to ensure that that go live went well. So teams were working around the clock to ensure that we were responsive and enabled our clinical teams to deliver what they needed to deliver safely for our patients. And one thing we know we are not that good at doing in healthcare is actually turning our data into useful information, but more importantly, intelligence and insights that actually drives our decision making. So for us as an organisation, this was about shifting from working on gut feeling, what do I think, to shifting the question to what do we know, now what do we think? And again, without that foundational EMR in place, we're not actually able to deliver on the promise of data-driven decision making. And so for us, we view this across three horizons. Again, as I said, we need that EMR in place as a foundational element to drive our digital strategy and to drive our digital transformation. Horizon 2 for us is being a mature analytics organisation. So That's around driving value for our consumers, for our patients, but also driving value for the organisation in terms of understanding our processes and understanding where we can make improvements around those processes. Since we've gone live with Track Care, we are now able to track consumable utilisation in real time. So I'm talking about real dollar value benefits to the organisation in terms of process optimisation and revenue recognition. Horizon 3 is the innovation horizon. Of course, Covid-19 has been a catalyst for some of that innovation, but again, the EMR is foundational in terms of allowing us to actually continue to automate, to utilise things like AI, and to embed the culture of change across the organisation. Partnership is critical, and this is a change for us. Traditionally, we've always seen our technology partners in a customer sort of vendor relationship. What the crucible of Covid-19 showed us was that we had to work in partnership with InterSystems to ensure that we got the benefits we needed to see through that virtual go live. So gone are the days of, almost in some instances an adversarial relationship. If we're not true partners in this, we're going to fail. And again, we'd just like to express sincere thanks to our partner InterSystems for all of their valuable work in getting our healthcare organisation, our healthcare system to where it has got to, despite the challenges that 2020 has brought. Thank you.